people are saying they don't hear from me on the pandemic. And you know, I reflected upon it. I've given all the statements, I've made all the appeals. And very soon I will be having a press conference on the pandemic. What the government has been doing behind the scenes is to refine a new set of measures that will enable the economy to continue, but to have the kind of control on movements that will prevent the spread of the disease. That is the real challenge. You know, how do we get the economy moving, keep it going, but at the same time control movement? The control of movement has been the principal tool of government in controlling the spread of the disease. We have used the curfew hours, we have used gathering rules, but people are getting fatigued. People are not, you know, willingly observing the rule. Greater effort has to be made in kind of resetting the minds of the people, because people are hearing vaccines are coming. They are seeing numbers going down in the United States, and they have been living with COVID now for over 9 months, and they feel it is soon coming to an end. It is not the case. I think that we would have another 9 months, literally, with this, even when the vaccines start to kick in. So the best solution, obviously, is to get every single Jamaican to follow the protocol. Wear the mask, maintain the social distance, sanitize, and don't move about unnecessarily. That's the key. But in the interim, there is a challenge, and the challenge is that our cases, our positivity rate has increased. But more than that, the number of persons seeking health care, that has increased. And now that is a threat, because whilst we can increase the number of beds, it's very difficult to overnight increase the number of nurses and doctors. And it is virtually impossible within a short space of time to increase the capacity of the current hospitals. So what you're finding is that hospitals have to be putting, you know, beds in the aisles and so forth in order to accommodate. That is not a situation that we want. And the only way to prevent the total collapse of the health system because of overburdening with symptomatic cases of COVID-19 is for persons to take personal responsibility. The government will also do some things as it relates to measures to control movement, control gatherings, and control what some institutions do. We plan to have a press briefing in a few days.